I want to start my contribution by recognising the hard work by the dedicated staff in CAMHS in trying to meet the needs of children with mental health difficulties. Any criticism I have is aimed directly at the Government and the systemic failures within the HSE. I listened to the Government's response to Mary Lou MacDonald at Leaders' questions today and was disappointed, but not surprised by the Government's decision to kick this important legislation down the road for 9 months. This will effectively mean that this legislation will not be passed during the lifetime of your Government. And the reason I'm not surprised is that there has been no urgency by your Government to tackle the crisis in children's mental health. This crisis has escalated to a full-blown emergency under this Government's watch. When I was named as Sinn Féin spokesperson for mental health, I said I would work in an opposition in a real, tangible, solution-focused way. But that commitment by me has not been returned. Time and time again, you've either voted down, amended, or, like today, kicked the can down the road when it comes to the solutions that have been brought forward. Now, I would love to take the credit and say I came up with the idea for this legislation to regulate CAMHS myself, but the fact is that this is the very first recommendation by the Mental Health Commission in their report on CAMHS. It was the primary recommendation amongst the 49 recommendations in the report. The Government's response is that this legislation will be dealt with during the reform of the Mental Health Act. It simply does not wash. There has been zero urgency to reform the Mental Health Act. We first got the heads of this bill over 3 years ago. I took part in the pre-legislative scrutiny at the Subcommittee on Mental Health that produced a report 2 years ago, and despite calls from myself and stakeholders to prioritise the publication of this bill, Government have failed to do so. Now, Minister, you don't have to believe me that there is a crisis in mental health, but believe the Maskey and the Mental Health Commission's reports. Believe the Children's Ombudsman, who said that CAMHS is unsafe. Believe the Children's Rights Alliance, that gave children's mental health another fail in that annual scorecard. Believe the hundreds of emails that I've received, and no doubt that you've received, by concerned citizens in support of regulating CAMHS. But, Minister, if you don't believe all of that, Minister, the least you can do is believe parents. As I said, I'm disappointed that the Government's decision to kick this legislation down the road, but my disappointment pales into insignificance when it comes to the disappointment that parents are feeling right now. I want to take this opportunity to welcome the Families for Reform for CAMHS into the public gallery this evening. I, Mary Lou MacDonald, and our spokesperson for health, David Cullinan, met with the Family for Reform of CAMHS just last night. We heard personal heartbreaking stories from parents about how their children have been failed by CAMHS. One distraught mother told me about her 10-year-old daughter, Maggie. She has already endured cancer. She now suffers from depression, anxiety and from self-harm behaviour. Maggie was on the urgent list for a year before she was seen by CAMHS. The urgent list for a year. She received assessment for an intellectual disability, but she wasn't accepted into the services because there was no CAMHS ID in her area. Maggie is in a mental health crisis. She is receiving no care outside of her family supports. She is in distress and will not leave her house apart from going to school. Minister, Maggie's experience is not unique. It is now becoming the norm under this Government. The Mental Health Commission's report into CAMHS highlighted several issues with CAMHS, including children lost to follow-up, lack of monitoring of psychiatric medications, unacceptable waiting times for high-risk referrals, and many more operational issues. We've seen waiting lists double under this Government, with the first-time appointments for CAMHS increasing past 4,400 in 2023. And this cannot be allowed to continue. We've seen the unacceptable postcode lottery of care to continue to exist, with certain counties receiving a lower quality of care. Children with dual diagnosis of mental ill health and an intellectual disability have fallen through the cracks, as are neurodiverse children. Parents, children and stakeholders have been highlighting the crisis in children's mental health, which has gotten worse under this Government. Sinn Féin have engaged with these families, we have engaged with these stakeholders, we have listened to their experiences, and we are taking them seriously. This legislation, Minister, is not the panacea for everything, but it's the first step in tackling the crisis in children's mental health and will lay the foundation to reduce waiting lists. Minister, you have dragged your feet on this matter, and now it's time to support this legislation. This legislation should not be kicked down the road. Our children cannot wait any longer. Good.
Ministers, last week we had a debate in this chamber on children with scoliosis and spina bifida and the need for improved services for those children. During the course of that debate and in the lead up to that debate, I met many of their parents and those children themselves, and I heard many heartbreaking stories. Today we're talking about young children and young adults who have mental health difficulties, mental health challenges, and whose parents and those young adults and young children themselves are telling us of their experience, Minister. And it's again one of a lack of services, a lack of opportunities, long wait times, an over-dependency on medication, not being taken seriously, parents not being taken seriously, children not being taken seriously, children with autism, again not getting the services that they need, and our mental health difficulties not being taken serious by healthcare professionals. We've had many crises in CAMHS, as you know. We have many capacity problems. That's not, by the way, on the staff who, in my view, right across the state are doing an excellent service. We simply don't have the capacity, and we don't have the referral pathways. We don't have the options for young people when they need them. I know far too many parents who ring me at all hours of the night. I could give you examples from our own constituency. I'm sure you've got similar calls of their young children who ended up in emergency departments because there was nowhere else for them to go, or they present to CAMHS and they're told to go home. And this is happening time and again. So there is a need for reform, and the Mental Health Commission made 49 recommendations. And as my colleague said, the very first recommendation, Minister, is that we would regulate CAMHS. I can't see how any government can be opposed to regulating CAMHS. I can't see how you can kick the can down the road. You're shaking your head and saying you're not, but you haven't done it. You've been in government for nearly 4 years. You're coming to the tail end of your government. You promised lots of things, but this is one of the things that was promised in terms of reform of mental health services, and it hasn't happened. We have a Mental Health Commission report which sets out a very clear recommendation, crystal clear, and we're proposing the legislation to make that happen. And what I'll say to you, Minister, is for all of those young people that I've met, I met many of them and their parents over the course of the last number of days leading up to this motion. As Mark said, we met with Families for Reform, who are ordinary parents who have come together to advocate for not just their children, but for all children, for all young adults. And what they're asking for is what we need to be delivering. So, like scoliosis and spina bifida last week, I can't understand where we're not listening to the very people who need reform and who need services. When you have parents of children telling you that their children deserve better, that their children are not getting access to the services that they need, we're clearly failing them. And I have to say, our track record so far, over the course of the last number of years, and I have to say under this government, when it comes to children's healthcare, is not good. We're seeing it right across children's health services. We have published reforms, not just in relation to this piece of legislation, but we have published very comprehensive reforms on how we want youth mental health to work better. And there's lots of solutions in all of that, lots of areas that need improvement. And we're not saying that this piece of legislation is in any way a panacea for all of the challenges in CAMHS or mental health for adults as well, right across the services. But it's a small step, and it's an important step. And when you have all of the experts, when you have the Mental Health Commission, when you have advocate groups, when you have parents telling you you need to do this, and you have a motion and a bill and a piece of legislation before you that actually does it, and yet the response from government is kick the can down the road for 9 months, is absolutely unacceptable. What you should have done is accepted this bill, allow it to go to committee stage, deal with any concerns that the government might have in relation to the bill, but actually deliver for those parents and for those children. And I'm afraid, Minister, look at what the scorecard was from recently that your government got in relation to children's mental health services. It was an E. It was a fail on your watch and on the government's watch, and that, I'm afraid, is not something to be proud of. So you need to do better. We all need to do better, and children certainly deserve better.
First of all, I want to commend my colleague, Deputy Mark Ward, for bringing forward this bill, and I also want to welcome all the families and parents in the gallery here for the debate. I come from the county of Cavan, which unfortunately has a very high suicide rate, and we've been one of the counties that has been the top 3 for having double the national average of suicides. Many of them, unfortunately, are adolescents, and adolescents who had engaged with CAMHS. And there were umpteen problems told to me by parents around around CAMHS and how the CAMHS teams work. First of all, parents are regularly waiting months from their child or their young person is referred to CAMHS for an initial appointment. There is an over-dependence on medication in the CAMHS teams, often not monitored or not monitored sufficiently. And use of alternatives such as counselling and play therapy don't seem to be taken into account. There's no out-of-hours service. There is a huge turnover of staff. We regularly have the psychiatrist on sick leave, being replaced by locums, which means a young person comes in and they have to relive their trauma by informing a new person of what the issues are, introduce themselves to a new person, get used to a new person. The next time they come back, it's somebody different, and they have to go through all this again. I have talked to many parents who have actually withdrawn their children from CAMHS because they felt that the interactions were so poor and often inappropriate that it was actually causing regression in their young person. Those families are in crisis. They've nowhere to turn. Children with an intellectual disability or neurodiverse children who have a dual diagnosis of mental ill health face an even greater battle. I mean, there's such poor collaboration between services. There's a lack of training for health and social care professionals. Autistic children are regularly referred to CAMHS with anxiety or mental health issues and turned away from CAMHS because they won't deal with autistic children. This has to stop. There has to be collaboration between the services and ensure that children get access to planned and continued care. CAMHS is not regulated under the Mental Health Act. This bill will ensure that children's mental health services are regulated under the Mental Health Act. The Mental Health Commission can make recommendations on governments and clinical reforms in CAMHS, but they do not have the statutory authority to ensure that these recommendations will be implemented. This bill will give the statutory powers to the Mental Health Commission to oversee and assist the HSE in their implementation of the recommendations. I urge support for this bill.
Minister, there is a crisis in youth mental health and it's turned into an emergency under your government. There is no way that you can deny that. Under this government, CAMHS waiting lists for first-time appointments in CH08, where my constituency of Longford Westmeath is, has grown from 270 in July 22 to 695 on the last available numbers. And the number of young people who are waiting over a year is 115, the second highest in the state. And here's the thing, Minister, behind each and every one of them figures is an actual young person, is an actual young child. In 2018, a 6-year-old was referred to CAMHS, and that referral was refused. In 2019, they were referred to community psychiatry, and the parents done the Timid the Tiger programme. In 2019, again, she was referred to CAMHS. At this point, she was 7. And I speak about this firsthand because I'm speaking about one of my own children. In 2020, while I stood in Dunnes Stores between the period of the general election and the Dáil first sitting, I got a phone call from the community psychologist. My daughter's referral had landed back on her desk, and there was nothing that she could do except to send it back to the GP. Finally, after a third referral, she was seen in 2022, after being on the list for maybe 3 months. So these figures go nowhere near the sheer scale of what the issue actually is out there in our community. And our children are suffering. My child certainly suffered. She's doing very well today, unlike many others who are still suffering. And Minister, that's wrong. You have the opportunity tonight to do the right thing. Let's regulate CAMHS, let's make it fit for purpose, and let's make sure no other child suffers for almost half of their life trying to find a service when there really is no need for that to happen.
Our children and young people in this state deserve better mental health services and should not have to wait significant times to access them. Children, in particular with dual diagnosis of mental health and intellectual disability, are falling through the cracks, as are neurodiverse children, something I experienced as a child and family support worker in Tuesday. Minister, I commend all those who are working in the area of youth children's mental health, doing a very important and demanding job. And I was sent these statistics by Jennifer from the Families for Reform of CAMHS, who's been explained earlier on, and I'll just run them off because they're absolutely shocking. This state has the highest level of difficulty accessing mental health services among citizens of 27 EU states. 44% of Irish people had difficulty in receiving treatment for a mental health issue compared to the EU average of 25%. 2021, Ireland ranked in the bottom one-third of 41 countries in the EU OECD for child mental health. 2020, the number of children aged 10 to 14 years who are self-harming increased, indicating the age of onset of self-harm is decreasing. 2020, 1 in every 128 girls and 1 in every 233 boys between the age of 15 and 19 presented to hospital due to self-harm. 2017, Ireland ranked the highest for girls dying by suicide in Europe. These statistics are absolutely shocking. This bill states that the Mental Health Commission should be given the statutory powers to oversee and assist the HSE in the implementation of the recommendations of governance and clinical reform. It will also allow for the Mental Health Commission to monitor the implementation of any such recommendations and to allow them to publish a yearly report on the progress. And it would allow the Mental Health Commission to publish an annual report to update on the status and the recommendations. Minister, I'm very disappointed to hear today when Deputy Mary McDonald asked for support for this, and that the government will not be supporting the motion and coming forward with their own amendment. And I think the people here tonight, and I think people in our constituencies, will not forget it. Children deserve better mental health services.
Níos mó neisceart, níos mó dhéanú ó hiú CAMHS de mar go bhfuil pleistí na tíre seo a ligean síos margheallar ar an rialtas tógain agus an chippetatú ó hiú meor chláinte agus an takeíocht a dheáil ar foiistí ar fud an stéid go heirí mo chun héin ina bhfuil go leor daoine ar lista fithimh. Children, Minister, deserve better. They deserve better mental health services than they're getting under this government, but the sad reality for so many children right across our state, the sad reality for so many patients are that they're waiting far too long to access mental health services in the country. Early intervention, as we all know, is key. It's with the deterioration of child's mental state often occurring when they're waiting to access services. Across the state, the CAMHS waiting list for first appointments have almost doubled in the space of a year to nearly 4,000 children and young people waiting to be seen as of August of last year. In my own area in CHO1, which includes Donegal, 294 children and young people are languishing on waiting list, and over half of them are waiting over 3 months. It's a postcode lottery for these children. Children and parents who are desperate, who are anxious, who are desperately waiting for the support that they need. Many who have dual diagnosis of mental ill health and intellectual disability continue to fall through the cracks. And these children and young people are the most vulnerable in our communities, but they're being failed over and over again. I heard of parents talking that they met with the Minister across the chamber and she was shocked, but nothing has changed. That was July they met with you. It's now August. We have a situation in Donegal where one of our teams has no psychologist, no social worker, no occupational therapist. This isn't unique anymore. It's no longer shocking. It is the normal what parents and children have to put up with day in, day out, as they're looking at their child who is anxious, depressed and suicidal, who is waiting in some cases for a full year to get that first appointment. It is absolutely an indictment of this government that they are letting down our most vulnerable in society. It's a situation that cannot continue for young people and their parents in my own county and indeed throughout the state. The legislation that my colleague Mark Ward has brought forward before the Dáil would provide for the regulation of children's mental health services, and it was the first recommendation, as we heard, of the Mental Health Commission in their CAMHS report, to giving the Commission the statutory powers it needs to implement their remaining recommendations. So this legislation that we have before us would help improve services and tackle waiting times for children, young people and their families to access mental health services. The legislation is a first step in ensuring that children in Donegal and elsewhere can access mental health services that need and deserve. It is appalling, Minister, that you're planning to pause this. And it's, you know, if it wasn't so serious, it would be laughable, because for most of these families, their life is a pause. It's another 9 months waiting for an appointment. It's another 9 months waiting for a follow-up. And what you're planning to do today is to pause the implementation of this legislation that was the first recommendation by the Commission on Mental Health.
I listened intently to what you said there in your response to this bill that I want to commend my colleagues for putting forward. The reality of the situation is, Minister, that we have worked with the Bills Office on this bill. We have worked with families, we have worked with parents, we have listened to families, we have listened to parents, and indeed we have listened to children in relation to this. The reality, Minister, is, and the facts are, that you are kicking the can down the road, with a promise of action down the line. What you're saying is, and the mantra that we're hearing from government is that children can wait. Well, we're being very clear on this side of the House that children cannot wait. We know from children, we know from families, we know from parents how difficult it is. And let's be frank here, most families have been affected by this in one way or another. But we know how difficult it is from children and from parents when they are in a very, very dark place and when they cannot get the help that they need, when they have nowhere to turn to and when they have no one to speak to, how difficult that is. We have come here today with a bill to actually try and work on a solution here, and all I'm hearing from government is that we have to wait, that children have to continue to wait. The reality is as well, Ministers, is that it isn't just a situation whereby it ends at 18 that there is this wait. When I see in the students and third level sector that I deal with in my portfolio, students, doctors, lecturers, people working in the third level institutions continuously come to me and say that they are not getting the assistance that they need in terms of mental health supports. Doctors are coming to me and saying that they are inundated. GPs, local GPs are coming to me saying they're inundated with trying to help students in the third level sector because there simply isn't the supports available in the third level sector. So, Ministers, I would like you to rethink your decision here tonight.
Ministers, I was present earlier when my party leader Mary Lou MacDonald questioned Minister Paschal Donohoe about the government's approach to all of this, and he proceeded to read out statistics and soft language. I just want to testify to the reality in my home county of Donegal for children with mental health challenges. We have a de facto block crisis. It's described as an earthquake happening in slow motion. Huge amounts of homes, 1,000 private and public houses multiplied by 7 or 8 or 9. So 8 or 9,000 in reality. And you know what the population of Donegal is. You can figure the percentage of the population impacted by this. It's absolutely devastating. Can you imagine the impact on families? The realisation that all of your hard work, all of your savings, everything's falling apart. So we had a huge mental health crisis. There are people who took their own lives. Some of it has been documented, some of it hasn't been because of this crisis. What supports have been put in place for children? There's been supports requested by Donegal Educational Training Board. There's been supports requested by campaign groups again and again. Nothing. Nothing substantial, nothing additional for those families. That's the reality on the ground, Ministers. Now, in terms of a recent development that's been raised with you, we have a pastoral centre counselling service. So these are tremendous people who are offering their services at a much reduced rate because they see the gaps. So they stepped up and they wanted to provide a service Some of the service was raised by fundraising of families who lost their children, and the campaigns are named after their children or the funding efforts. So they stepped in the absence of state provision services. They were getting some supports from TUSLA, from the HSE, but they were getting no supports in terms of clinical oversight. For example, they'd asked for a director of counselling, and we know in parts of Ireland the failures in clinical oversight within the CAMHS system. But here were professionals offering that, no admin support. I've got 30 seconds left. There's 2.5 per speaker. No. Oh, apologies, my apologies. I thought it was 2.5. Apologies.
Last count, Carla. No problem. This type of an amendment, it work should have been done on this a long time ago. But while the regulatory powers are important, the material resources are also key. The system that developed in Kerry, not just South Kerry CAMHS, was a product of pressure, carelessness and a lack of oversight, where medication was the only solution provided, and the psychological, the therapies, the behaviour developmental and other issues were not focused upon. The persistence of families and young people, many now adults, through the reviews is a case study in dignity and standing up for the right thing. The reports clearly demonstrate the over-medication and appropriate care that took place in South Kerry between 2016 and 2021, and it's worth placing on the record that the devastating effects, the emotional issues, the physical changes in children's bodies, all compounding the issue faced by one of the most vulnerable cohorts in our society, children with mental health difficulties. For those within the South Kerry area, the redress scheme has been introduced, but I'm reiterating my call for the redress scheme to be extended to those who have received an apology from the HSE already. It's totally unfair that they have been excluded from it. Their needs are no less demanding than the other people who are in the scheme. And it's especially needed for those individuals so they can take a case about what happened to them so that they can get justice. They are not wealthy people. Natural justice demands that they are compensated as quickly as possible.
Minister, the government's response here is a nonsense. A programme for government commitment unacted upon, and we are expected to simply just wait because you're promising an all singing, all dancing bill, and we promise you it'll be better than what you have, but nobody's seen it. I don't think that's good enough, and I don't think there's any reason to not support this legislation. Work with it through committee stage, absolutely, and there are elements, I'm sure, that can be worked upon, but there is no reason to delay the passage of this given how long it has been promised. The system is in absolute crisis, and it is getting worse. In my own CHO community health organisation, like I was just looking at the numbers again there, and like we talked about statistics, these are so much more, but like they do tell a story too. They do tell a story too. There's 574 people more waiting now than there was in July 2020. There are 348 waiting longer than a year. 348 children waiting longer than a year in Cork and Kerry for a CAMHS appointment. That's more than there are in some other CHOs on their own. It is an absolute scandal. And, you know, I'm not sure necessarily everyone understands. I know the people in the gallery here will understand how difficult it even is to get into CAMHS, because there is such an impulse to try and push people back onto primary care. Like, there are people that I have encountered, and they have been primary-aged children, self-harming, and they have been told that they weren't severe enough for CAMHS. So that is how severe you have to be to even get into CAMHS, right? And that is one of the problems as well, and one of the issues that the Mental Health Commission should be addressing is the criteria, and CAMHS not accepting things that they would have accepted in the past, but to even get into it at the minute is so difficult, and that is some of those cases that are waiting longer than 12 months, and that issue needs to be addressed as well. I think also the people who can't even get into CAMHS, who are too severe for primary care but not considered severe enough for CAMHS, that's a huge issue that needs to be addressed.
And I'll just follow on from that, because that is a very serious issue, and one of the impacts of what happened in Kerry of that scandal is that CAMHS started to push children out of push young people out of the system and back to their GPs. That is an absolute fact of what's happened in the West. You should know that, Minister. if you don't, you need to investigate it properly. We've seen a 6-fold increase in children on mental health waiting lists in the West. 6 times as many children waiting as when this government came into power. This is a practical piece of legislation, but there are immediate things that need to be done as well. Now, I would ask the government to put their egos to one side and put the young people first who are really suffering from this. Autistic children with serious mental health issues are going untreated. I wouldn't even be able to describe to you the cases that come across my desk with the way autistic children with mental health difficulties are treated and their families. That includes children with suicidal ideation being turned away from CAMHS, children with intellectual disabilities having no CAMHS service. There is an immediate response needed here. I would ask you, but just look at the family resource centres. See, can you put some funding in there to it to make sure every day we come in here we're told millions and millions everywhere, but it is not getting to the young people and the families that desperately, desperately need this support in order to save their lives in many cases. It is totally wrong what's happening. This motion is straightforward and it's a practical step that can be taken. It calls for the implementation of the first recommendation by the Mental Health Commission. If passed, it would give the Commission the powers to implement the other recommendations. This is what families and stakeholders want. We have talked about this for years. I worked in community development myself, as you know, and this has got worse and worse in the last 20 years, and it's at a beyond crisis point at this stage. So please, leave the egos outside the door and put the children and the young people first in this case.
Thanks very much, Ceann. Minister, there's nobody in this House believes that we'll be sitting here in 9 months' time that this Dáil will be gone. So you are actually not just stopping this bill, you're not just delaying this bill, you're torpedoing this bill, which is very unfortunate. It's a bill that looks to give statutory powers to the Mental Health Commission to regulate the child and adult mental health services. It will allow for the implementation of the Mental Health Commission recommendation and for the Mental Health Commission to monitor the implementation of these recommendations. It's an important bill and one that we feel obliged to submit, as if we were to wait for your government, the necessary changes would not come about. Reform of the Mental Health Act is in the programme for government, but 4 years later, little or no action has been taken. Children deserve better. They deserve better than to be waiting for treatment. They deserve better than the postcode lottery as to when they will be seen. A child facing a mental health challenge is heartbreaking. It impacts their informative younger years. Not only is it frightening and challenging for that young person, but it places immense pressure on their parents, their siblings, their school children, their schoolmates, their teachers and their communities. Early intervention is so important, often making a huge difference. Childhood is a fleeting time, and where help is needed, it should be offered as soon as possible. I would like to briefly mention a fantastic group in Limerick that offer incredible support to children who are faced with some difficult challenges. I'm referring to the Bedford Road project in Limerick, who I met yesterday. They're currently battling to secure funding and to maintain themselves for the future. After a quarter of a century, their 25th anniversary, they're facing closure. They have provided coping skills to children and their parents. They are some of the unsung heroes of children's mental health services. CAMHS waiting lists have increased under this government. There are 3,891. 196 of those are in my own CHO area. This is an emergency and isn't being treated as such. We've seen from recent reports, in particular the Maskey report, there are significant problems with CAMHS. Far too long in the state, mental health issues have been treated as a poor relation of the health services family. Proposed changes in supports never seem to arise. In Limerick, we've been waiting for the rollout of a trial 24/7 mental health de-escalation unit. Every time I seek updates, I'm told it is on the cusp of being launched, but we haven't seen it delivered. If the government were serious about mental health protection, and the unit would have been up and running already. Those children on mental health waiting lists are waiting long enough for you. Your tighter approach to mental health needs to change, Go Margaret.
The Mental Health Commission's report into CAMHS highlighted a number of issues, including children lost to follow-up, lack of monitoring of psychiatric medicines, unacceptable waiting times for high-risk referrals, and many, many more operational issues. When I chaired a meeting of the Oireachtas Health Committee in January, we heard that there were now 4,400 children on a waiting list for their first CAMHS appointment. This number has almost doubled in the last 5 years and lays bare any attempt by the government to pretend they're making a difference. Many multidisciplinary teams across the state are missing key personnel, have long waiting lists and are unable to deliver support and services for children and young adults. Children with a dual diagnosis of mental health and intellectual disability, or particularly children with autism, are being neglected in the refusal of CAMHS. This is clearly a broken system that forces many parents who understandably want to get their children the help they need into expensive private diagnosis, and then when there's no way to access public care, into private treatment and even greater expense. This is no way to treat vulnerable children and their families that need help from our mental health services. The services for adults are barely adequate, but it seems that services for children are barely functional. Children cannot wait any longer for CAMHS to be reformed. No child, and certainly no sick or vulnerable child or young adult, should have to wait months or years for quality care within our mental health services.
Minister, figures released to Sinn Féin show a shocking 158% increase in CAMHS waiting list in CHO4 from July 2020 to August 2023. 348 of these children have waited over 12 months for an appointment. This is completely unacceptable. Last year, I was contacted by a lady whose daughter was in severe distress. She had to bring her to A&E for help. CAMHS arranged an appointment but needed a report from the A&E or the appointment would be cancelled. The woman was out of her mind with stress and worry. I had to contact the hospital and we did get the report, but it just shows you how the system has completely collapsed. Like, people do not seek mental health support for their children. Parents don't do that unless it's really serious. And Minister, like, the consequences of COVID on everyone, but especially on children, and especially on vulnerable children who need support from CAMHS. And I tell you now, Minister, this government, you've abandoned our children. You've abandoned our children. These children who are 348 of them in Cork and Kerry waiting over a year. And Minister, the former Minister, Simon Harris, said that we need to see continued reductions in the number of children waiting for CAMHS and the length of time is reduced, right? On the Fianna Fáil and Fine Gael, all we've seen is children waiting longer. And these children, Minister, are begging for your help, for our help, and they need to get it.
Thanks, Count Corder. Minister, the government's response to the text, in relation to the text of this bill, is just smoke and mirrors. And I know that, you know that, and people listening know that. If the government is not happy with any aspects of this bill, send it into the committee and do pre-legislative scrutiny. That's what pre-legislative scrutiny is there for. If you weren't happy with the bill, why didn't you simply vote it down? It's still going to be the same bill in 9 months' time. So what you're doing is contradicting yourself, Minister, which I'm not surprised of. All opposition were in favour of this bill and in favour of this bill to progress now and not kick it down the road in 9 months' time. So, Minister, we need to stop this nonsense. I want to acknowledge the families here again tonight who stayed for 2 hours of this debate, and I'm sure they are pulling their hair out with frustration. It just shows how much this really means to them and how much it means to them and their families, but most of all what it means to their children. Minister, their children simply deserve better than what has been going on in the Houses of Parliament tonight. Minister, I don't think there's a bigger crime in this world than denying a child the opportunity, every opportunity to reach their full potential. But I think that is exactly what the government is doing tonight by delaying this bill. I want to address some of the responses that you said in relation to the bill. You mentioned the reduction in waiting times, and any reduction in waiting times is welcome. But I want to bring to your attention the latest figures that I have. When the government was formed in 2020, we had 2,115 children waiting on a first-time assessment with CAMHS. This now stands at 3,891. So that's an increase of 1,800 under your watch. 656 of these children currently are waiting for over a year, Minister. So how can you stand over this? Your response in relation to the budgets, like if you didn't know better, you think everything was rosy in the garden. But quite the contrary, mental health, the overall budget allocated to mental health has fallen under this government, and the percentage of has fallen under this government. You mentioned an increase in 68 roles in CAMHS versus this time last year. Again, any increase is welcome. But will this increase open the 20 CAMHS beds that are currently closed under this government's watch? Will this increase fully staffed CAMHS ID teams? Will this increase stop children falling through the cracks when they reach the age of 18? You also mentioned the new roles in relation to youth mental health, but that's not what you asked for originally, Minister. You asked for, and I supported you in your call, for a National Clinical Director for Mental Health, but you failed to deliver on this. You mentioned that there has been an increased referral in the CAMHS, but you failed to mention the reasons why. If our young people are getting the early intervention at the earliest possibility, they are less likely then to need the more acute services of CAMHS as they get older. And I'm talking about in relation to the 16,000 young people who are currently waiting for primary care psychology. We've waiting lists in Jigsaw. In some parts of Jigsaw are doing really well, but that postcode lottery of care exists in other parts of Jigsaw where children aren't getting the appointment that they need. Minister, when I bring forward this legislation, I was talking to parents outside. I don't want to bring people's hopes up just to have them dashed. That's not what I'm here for. My job is to bring forward good, proper legislation. And to give it as an opposition, you might have an army of staff there. I have myself and Joseph up there, and I want to thank him. There's 2 of us in my office that have been working on this with stakeholders, with families. We bring it forward to you in good faith. You had an opportunity here tonight not to kick this down the road and let this go through pre-legislative scrutiny, but you've denied parents, you've denied children that opportunity. And Minister, I said it before and I'll say it again, our children deserve better. This legislation was not the panacea. We never pretended it was to fix everything that's wrong in mental health. But my God, Minister, it was a step in the right direction.